Good to see you this morning. Damar is already trying to pay it forward, the life-saving efforts taken on the field to save his life. What is this 3 for a Heart challenge? Tell us about it.
Well, I think, first of all, thank you for wearing red also. We really appreciate it. It is National Red Day today. It's really 3 simple steps that anybody can do. So first is learn CPR. Second is to give, so share and give that information to other people. And then third is also to make sure that you are helping us as an organization, the American Heart Association, raise awareness by helping donate to our causes.
Yeah, I've been hearing for years that heart disease is hereditary. There are all of these risk factors that we know about. And then there are so many things that we can do in our daily action to prevent it. What does some of the research show? It is still our leading cause of death. Are we headed in the right direction? Have we seen improvements in people understanding their risks and doing something about it?
Well, we are seeing a decrease in overall cardiovascular disease mortality, but we still have a lot of work to do. And I think, it's really simple things that people can do to improve their heart health. So it's getting more sleep, it's knowing your numbers. What's your blood pressure? What are your lipids like? Do you have diabetes? Getting your physical activity under control and making sure that you are getting the right amount of physical activity. So it's super simple things that people can do that make a huge impact.
I often hear that it can be daunting to take that first step into creating a heart-healthy lifestyle for yourself. I've been involved with the Heart Association for years, and I had a woman say, I just kept talking myself out of daily exercise, eating right, because I think my health was just too far gone. What would be your advice for people to step out, take small steps that can then lead to big change? You don't have to go and run a marathon tomorrow, but what are some things you can do today to make simple changes that are healthy?
Well, it's really pretty easy, right? I think it's all about little small things that you do every single day that can make a huge impact. So maybe it's getting 30 minutes of exercise every day or up to 5 days per week. Asking your doctor to look at your blood pressure, check your cholesterol, get your glucose. Stop smoking. That is a huge risk factor that we know for heart disease as well. And then, of course, any dietary modifications that you can do, even small little things like just really starting to watch your diet, losing just a few pounds, all of those things are going to make a huge impact on your heart health.
Right. Leave the fries off of the side if you're having a burger. Take the stairs instead of the elevator. Park farther away when you're walking into the building. All good things. A lot of women are wearing red today to raise awareness for women's heart health. What does some of the research show about women's heart disease, some of the discrepancies that we see when a woman suffers sudden cardiac arrest versus a man?
Well, I think the first thing is that we do know that women are oftentimes underdiagnosed in terms of recognizing that they've had a heart attack, even recognizing that their heart has stopped and they've had a cardiac arrest. And so the first thing is, women, you have to put your oxygen mask on first, right? I think oftentimes, I know I'm a mom, I always sort of think about everybody else before I start thinking about my own health. But here's the thing, if you're not here, if you don't take care of yourself, you cannot take care of anybody else. So, this is really where it becomes really important. Number one, for you to take care of yourself, for you to teach other people what to do if something were to happen to you, for example. And then, of course, most importantly, it is making sure that you're following through on all of those very simple lifestyle things that we know can make a huge impact in terms of making your life not just longer, but also healthier as well.
It's great to see Damar a moment ago really pushing this national conversation on heart health after what he has been through. What has he done to the CPR campaign and awareness over the last few weeks to make people aware that it can happen to anybody, even an athlete in the elite of their sport?
I think the biggest thing that this has really done is that it has put cardiac arrest on a national level. We have never had so much talk, so much engagement about people thinking about what is cardiac arrest? What is CPR? What happens if I go to, let's say, my child's soccer game? Is there going to be an AED, an automated external defibrillator there? So I think we're having a national conversation, not just about cardiac arrest, but also just about emergency preparedness. What are people going to do if something were to happen to me, if I have some type of medical emergency? And so I think, number one, I think he has just really revolutionized not only what we're doing in terms of getting people to act, getting people to learn how to do CPR, getting people to share that information with other people, but we're forever indebted to him as the American Heart Association, just really helping to raise awareness and letting people know, look, it can happen to anybody.
Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.